Okay, good afternoon, everyone, and thank you for coming out for our program this afternoon. We have with us today Dr. Christine Jensen, and Dr. Jensen is the Director of Health Services Research with the Center for Excellence in Aging and Lifelong Health that's located up in Williamsburg. And she has been working on a project for a few years now called Caring for You, Caring for Me, which was initially started with the Rosalynn Carter Institute for Caregiving down in Georgia. And she has brought it here to the peninsula, so she is going to give us some background information about the Caring for You Caregiving program and how it can help professional and family caregivers. So without further ado, if you would please welcome Dr. Christine Jensen.
Thanks, Minnie and Lynn, for having me. Does everybody know everybody in the room already? No? Okay. I was just curious who was in the room, if you all wouldn't mind to introduce yourself real quick.
My name is Christine Brady.
Okay, great.
I'm Carter Brady.
Okay, related, I'm guessing?
Yes.
Okay, all right.
I'm Lacey. I'm a research intern with Dr. Jensen.
And Lacey is a graduate student at VCU, and she's helping me in Williamsburg with this project.
I'm Rosalynn.
Great, thanks for being here.
Overall.
Okay, great. Your name? Just was looking for everybody to introduce themselves. Your name?
Geraldine Boron.
Geraldine, good to have you here. Thank you.
Joe Calise.
Joe, good to have you here. Thank you all for being here. And if you'll pass on this information to others that you think might be interested, we would appreciate it. But Manny and I had been talking, and we thought that there was a way we could get some information out to you about caregiving issues. And then if you're interested, before we leave today, you can sign up for more information, because we think this 5-week program that I'm going to tell you about is something that we'd like to offer here at the center, perhaps looking at a February time frame. So we'll let you know how you can sign up and how we can stay in touch with you about that. So wanted to share with you, all right, Minnie, you got to remind me here. I just slide down. Okay, great, thank you. Quick learner once I see the right things here. So this is Mrs. Carter. You remember Rosalynn Carter, our former First Lady. I know this picture's a little bit dark. She had on a dark blue pantsuit and her large set of pearls. And I was invited to go and meet with her last year about this time, so it's been almost a year ago, in October in Georgia. And she has an institute that looks exclusively at caregiving issues. And it's called the Rosalynn Carter Institute for Caregiving, and they call it the RCI for short. It's in Americus, Georgia. I'd never been there before. I wasn't sure I could get there from Atlanta. It's like a 2.5-hour car ride. Are you familiar with that area? It was a good little long trip from the Atlanta airport to get to Georgia Southwestern State University, where Mrs. Carter graduated and where she's created this institute. And it's been in existence for 25 years. So the institute was just celebrating its 25th anniversary. And when I think of the Carters, I think of Habitat for Humanity as something that they were really involved in. And then you know that Mr. Carter's been traveling and still doing his peacekeeping missions in a number of other countries since he left the White House. I really didn't know until very recently that Mrs. Carter was so involved in caregiving issues, and it's for a very simple reason. She ended up needing to help her mother provide care for her grandfather, her mother's father, and then when Mrs. Carter's father became ill, she was also helping care for him. So the family caregiving is something that's very near and dear to her heart, and she has created this institute. It hadn't opened when I was there a year ago, but now there are 2 new buildings on campus called Carter 1 and Carter 2, where the institute now resides, and they have this beautiful statue of Mrs. Carter out front. But Mrs. Carter is still very much, that'd be strange to have a statue of yourself while you're still living to be able to see it, but a beautiful statue of her out in front of the building. But she is 86. She's doing very well. She is shorter than I am and thinner. She is very petite, but she really knows how to enter a room and captivate people with her speaking. She's very soft-spoken, so you have to listen very carefully. And of course, she still has Secret Service detail with her everywhere she goes. So when I was at this summit that her institute holds, and that's when I had the opportunity to go see her when they had this conference, we were sitting in one of the conference rooms, and all of us were eating from this continental breakfast, and it was just fruit and muffins and coffee, and we had paper plates and napkins, and I noticed that Mrs. Carter's silverware and china looked a little different than the products we were eating off of, because as a former First Lady, she is still expected. She doesn't expect it, but everyone else tells her that she must eat off the fine presidential china and drink out of the coffee cups while we're having our styrofoam, and paper plates and things. So it's really fascinating. But she always has somebody assigned to her everywhere that makes sure she's having the fine china for all of her meals when they're served. So, but this was in an old home, a very much traditional kind of Georgia mansion right across the street from the campus where we got the opportunity to speak. And I tell folks when she and I were introduced, and she knows about the work that we're doing with her program from Georgia that we brought to Virginia. And when she said, now you know that the Caring for You program is our signature program. You know that's one of my favorite programs. I mean, what do you say to the former First Lady? I was like, yes, ma'am. I think that's all I could probably say. But I did want you to know that this is not a program that we can take credit for creating in Virginia. It is out of Georgia, and they're very, very excited when other states and communities want to bring it to their community. So we're very happy that it's in Virginia. It's been in Virginia for almost 5 years now, and Mrs. Carter's very aware of what we're doing, and so much so that she is considering a visit to Virginia here in another year to come and learn about what we're doing here firsthand, which would be very exciting. And they just say, she's just 86. She can travel whenever she needs to. You just let us know, and we'll get it on the calendar. But you have to schedule out 15 months in advance if you want her to come. So we're working on that, so stay tuned. But that's been a whole fascinating piece that I didn't know about, kind of your former individuals that have been in the White House. So before I tell you about the program, and please stop me if you have any questions as we go along. I know this map is small and you don't have to worry about the details, but the bottom line is that this is the Commonwealth of Virginia and all of our independent cities and counties. But the key is that we rank 12th in the U.S. out of all the states and territories in terms of the number of individuals that are providing uncompensated informal care, meaning they're family members who just do it because they feel the need to. And we're going to talk about those reasons in just a minute. If we just paid these individuals under $10 an hour, they would be saving the healthcare system. Our Virginia caregivers, families, would be saving the health system about $10 billion a year every year. That's what we save the health system in informal, uncompensated care. And so Mrs. Carter's very fascinated with this. Georgia doesn't actually rank quite as high as we do, but this is where she said, well, if these folks are going to care for their loved ones, and many of them, it is a family member, they wouldn't have it any other way, what can we do to kind of arm them and help them be better advocates for themselves and their loved ones? And that's where the Caring for You course kind of originated. But I wanted you to know where Virginia stood. Also wanted to let you know briefly that we do have a Virginia Caregiver Coalition. So we do have people around the state who care about caregiving issues for both family members and professional caregivers, and it's called the Virginia Caregiver Coalition. There's a lot of detail on this slide, but just in short, the purpose of this coalition, and there's no cost to join the coalition, I can tell you more about it later if you're interested, is to improve the caregiving experience and outcomes through education, advocacy, and resource accessibility so that caregivers are valued and supported. And it was initiated in 2005. It's based in Richmond at our State Department for Aging, called the Virginia Department for Aging and Rehabilitative Services. And again, it's free to join. It's for both professionals and families. We have programs every other month, and you can participate from wherever you are in Virginia as long as you can get to a health department. We have satellite feeds so that you're live with everyone else as they're participating from the Richmond site. So I just wanted you to know about the Virginia Caregiving Coalition. And one more piece kind of at the state level that you know about is that we've been talking about for a number of years that we need more dementia support for persons who are dealing with memory loss, like Alzheimer's disease. And we need more support for the family members that take care of them. So the governor has signed into law and put money aside, which was actually budgeted and funded, and we have now hired in August a dementia state coordinator. So she works out of Richmond, but she supports the entire state. Her name is Charlotte, and she is doing a terrific job of trying to work with the 4 chapters of the Alzheimer's Association that are located in Virginia, as well as all the other programs that are going on to help family members and professionals do a better job in caring for persons with dementia. So these are just things I wanted to let you know that are happening, that are good signs. I think caregivers talk about I'm kind of forgotten and I feel isolated and people don't even respect or value all the things I'm doing for my loved one. There are advocates out there on your behalf, so I just wanted you to know that. All right, well, in the historic triangle where we are, and York County is actually leading the pack by far. These numbers are small, but just to quickly share with you that we've done some research at our center and looking at how is the population of persons 65 and older going to increase from 2010 to 2020. And so we look at census data, we look at the Virginia Employment Commission data, and we see that James City County, which is where my center is located in Williamsburg, is growing at an increase, will increase over that 10-year time period at almost 34%. 14% for the city of Williamsburg. There's not much room for growth in the city of Williamsburg. It's pretty much grown out as much as it can be, and so we have obviously a number of college students there as well. But York County, there's still a lot of room for growth, and this surprises me that the increase in the percentage of persons 65 and older, 72%. Thank goodness we have the senior center and many other services that will support that. So wasn't sure if you were aware of where York County falls in this growth rate of persons 65 and older who are going to be caregivers for persons in their 80s and 90s or who will need a caregiver. So let me tell you about the Caring for You, Caring for Me program that Minnie mentioned to you. And I don't know if that brochure looks familiar to you, Minnie. Minnie helped me get this program off the ground about 4.5, 5 years ago, and I just passed and realized, I was pointing out to Lacey, York Minster Presbyterian Church was the very first place that we offered Caring for You. That's just right down the road. They were very supportive. But we created a brochure, and we received funding from the Williamsburg Community Health Foundation to bring this program from Georgia to Virginia. And this was in 2009. And there was no reason to change the name of the program. We wanted to preserve that and keep the integrity, so we've continued to call it Caring for You, Caring for Me. And we had an individual by the name of David who wrote the original curriculum, who came to Williamsburg and trained us in the curriculum. We spent a day with him to learn about this 5-week program. So what I'm going to do for the next few minutes is just give you an overview about the 5-week program. And then I can answer any other questions, and then I'd like to get a sense of if you think this is a program that we ought to explore offering here through the Senior Center. That's something that we're very interested in. So again, to summarize, it was founded in 1996, so it's been around for a while. And in fact, I was first exposed to the program in New Jersey when it was being offered, when I was a resident there in 2001. But it wasn't until 2009 that we were able to bring it to Virginia. But it is a 5-week course. It's 10 hours of instruction. It's 2 hours each class. You pick a time and a day of the week, and it meets consistently on that Thursday morning or that Tuesday evening for 5 weeks in a row. We ask the individuals who attend to complete some evaluations for us at the beginning and at the end of the program so that we can better understand their experiences. And this was just my little quote about how it's packaged works. It's 5 weeks. It's not an ongoing class that folks are taking like other monthly support groups, and those support groups have a very valid place in the community, but I like that this tells folks, here's the start time, here's the end time. They can really try to commit to that, and they know they don't have to continue on after that. But we also try to help individuals who are attending the class, if they need care for their loved one so they can come to the class, we'll help them with those respite services. And we now have a grant through the Altria Foundation in Richmond that is actually helping us cover the respite care costs, so that if an individual wanted to contract with Comfort Keepers, Home Instead Senior Care, just to give an example of 2, then we could help cover the cost of that so that they could come to the class and not be worried about the care for their loved one. They would know that they were in good hands. When I have somebody call me to register for the course and I say, Mrs. Jones, I would love to have you in the class, but do you think your husband's going to be okay while you attend the program? And if they're kind of hesitant with me, I think he'll probably be all right if I turn the TV on or put a movie in. I usually try to follow up and say, let's talk about either a neighbor coming by or a church member, or if we need some more formal care to come in. So we don't want folks to come to the course and be worried the entire time about their loved one. We want them to come and kind of know their loved one is safe and that this is a course for them. We say everything's confidential that you discuss, and it is not meant for the care receiver. It is meant for the caregiver to come to the course. So we do have care receivers show up sometimes because they're so attached to their loved one, they go wherever their loved one goes. And so we have some systems we tried to put in place with additional volunteers that can kind of walk with them or do other things, but we tried to avoid that by being very clear with the caregivers up front. This is designed for you, and let's put some other supports in place for your loved one so you can come out during this time. But in order for this to be successful, and this was a part of what Mrs. Carter designed, is that it's not just a program for families, that it also includes professionals and volunteers. So professional staff from long-term care facilities, assisted livings or nursing homes, professional staff that work for the respite care and companion care companies like I mentioned, like Home Instead, Bright Star, Comfort Keepers, Riverside Home Care, Centera. And then volunteer caregivers. We've had a number of volunteers from hospice agencies that come and take the class. And it really works best when you have all those different types of caregivers together, because then they can problem solve and strategize and advocate for each other. So this huge figure that I have there in purple, the 5,000, this is not easy math, but we've tried to calculate, since we offered the course starting in fall of 2009, how many people have either completed the course as an actual class participant, been a trained facilitator for the course, or who have helped somebody else as a result of the course. And this is our calculation that we believe. I mean, keep in mind, if you've got a family member who takes the course, they benefit plus at least one other loved one. And we know many family members are caring for multiple loved ones, a spouse and perhaps an in-law. And then we have professional staff who may be caring for multiple individuals, 5 individuals, 10 individuals at any given time. So that's how we have come up with this calculation of how far-reaching this course has been in Virginia. And in fact, we've had some people who've taken the course who are caregivers here, but their loved one that they're caring for is long distance in another community or even in another state, but they've benefited from the program because we've had it here locally. We have received 2 fairly major awards for the work with this over the past 2 years. This was very exciting to be recognized by the Commonwealth of Virginia and the Council on Aging. And the first place award also came with a little bit of cash that allowed us to continue to offer this program. We only charge $35 for the entire 5-week program because of the additional funds we've received that help us keep it at a very low cost. So here's what this looks like. If you were to take the course, I won't give you all the details, I don't want to spoil some of the fun, but it is done with slides so that you have kind of some formal lecture material. It is a course, it is a seminar, but then there's also a lot of time for everybody around the room to learn from each other. Typically you'd have 10 to 20 people take the class at a time. But you start off by talking about what does it mean to be a caregiver? Are you a caregiver? Or are you getting prepared to be a caregiver? How did you end up in this situation? What kind of supports do you have? What help do you need? I'll get it figured out, Minnie. I'm going the opposite direction. Okay, then week 2, that's week 1, 5-week course. Week 2, we spend a lot of time working with the folks who are in the course, helping them learn how to take care of themselves. And to some that might sound silly, but if you've ever been involved in caregiving, whether for a child or another relative or family member, many times when we're caregivers, we put all of our care needs to the side to manage the care for somebody else, to the point where our health could be sacrificed. We had a woman who was taking the course at a retirement community in Williamsburg this past spring. And I was actually worried about her when she came into the course because she looked so frazzled. I thought maybe the course, I don't want the course to make you more stressed. I think the course ended up being very beneficial to her, but the first thing she revealed to the group was that she was in the sandwich generation, caring for her mother who was failing in health, and she had 2 high school kids at home, and she was a single mom. And the first thing she shared with us was that she had not been to the doctor in several years and that her kids had just missed their sports physicals because she was so busy getting her mother to her doctor's appointments. So we really tried to kind of work with her as a class and help her come up with some solutions so that her children wouldn't have to sacrifice so much and that she wouldn't have to sacrifice so much in terms of her own health and well-being. One of the things that we talk about in this second week is this quote, and I think we don't value it enough, but the healthiest way to care for another is to care for yourself. And so we even use that quote that you've heard about. If you've ever flown on an airplane, you've heard people say, put your oxygen mask on first before you take care of the person or the child or the person flying near you. It's that kind of idea. Imagine if we didn't take care of ourselves and we're supposed to be taking care of somebody else. How can we do that? How can we give that 100%? We might be able to, but not for very long before we fall apart. We actually do geriatric assessments at our center in Williamsburg. And we had an individual come in recently, and he didn't know why he had had a stroke. It hadn't been very well explained to him. And he recovered quite well from the stroke, but it turns out that his wife was very ill. He had been caring for her round the clock at his home, and the stroke happened when she was really starting to go downhill, and she died 2 weeks later. And here he was, had just had a stroke. And when our group of professionals were able to look at him and look at an MRI and a CAT scan, really thought that the stroke was stress-induced, which was really fascinating to think about that, that's negative of a consequence could happen from not taking care of yourself because you're so committed to caring for someone else. And the job with this course is not to say, oh, it's easy, do a better job of taking care of yourself. It's not to minimize it at all, but to take it more seriously that you've got to be in better shape physically and emotionally to be able to continue to give this care, or something's gonna end up happening. All right, I'll have this learned by the time we're finished here. So one of the other things I wanted to let you know that we do during the second week is that, and again, there's a lot on the slide, but I'll try to be very brief here, is that we actually give the participants several surveys that they take during that second week. It's a checklist for caregivers. How do you do taking care of yourself? We ask them to identify the negative emotions, the frustration, the guilt, the anger, the resentment that they might be feeling. And then we ask them to talk about who are their social support systems, who are the people they can call on in their church, their neighbors, other family members, other professionals, the doctor that they can call on. And so this can be very eye-opening for individuals. We also give individuals during week 2, we try to remember to give everybody a Q-tip. And they think this is crazy when they come in because we put a little Q-tip, like you'd clean your ears with, at everybody's station when they come in for week 2. And we say, think about how do you spell Q-tip? Q-T-I-P. Quit taking it personally. That the individual who's being cared for may not be real happy about the position they're in either. They may lash out, they may be angry and not acting very pleasant or showing appreciation for all that you're doing. Quit taking it personally, and let's get to the root of why we're doing this, and that's to provide care for this individual in the best way that we know how. The third week, we talk about how to build better relationships with family members. We hear many individuals who are adult children who take the class say, somehow I'm managing all the care for my mother and my siblings have just conveniently disappeared. They are busy. I took her to the doctor once and they figure I've got it taken care of for the next 10 years. So we help them digest and talk through these sibling issues or other family members, who lives closer, who lives further away, at what role can people be involved, and how to encourage that, and also how to encourage a relationship with the physician. And your physician, too, as a caregiver, should know that you're a caregiver. That should be in your medical chart, so we advocate for that. And your relationship with others in the church or in the neighborhood that can be of support, too. So those are the kinds of things we talk about in week 3. In week 4, we talk about the different types of problems that the caregiving family might face. Finances, legal issues, again, the sibling issues, or families that deny what's going on until there's a crisis issue. So we talk about all of those things and then strategize about how we can head off some of those problems before they become too severe. And we encourage again, it's not a lot of lecture where you're just sitting there. There's a lot of dialogue and discussion, and we encourage that. That's what makes the class work so well. And finally, the 5th week is all about accessing resources. And so we allow folks to kind of vent their frustrations. I called this agency and nobody called me back, or I got the runaround, or everybody gave me a different answer each time I called. We allow them to kind of vent their frustrations about networking with community resources, and then we get down to here's how you can more effectively do this for yourself. And we talk about keeping a journal and a log to manage these kinds of conversations. And we also actually have a resource fair. So we bring in all kinds of materials that we know about that we think would be helpful, not playing privilege to one agency over another. And we allow the attendees to just get up and spend some time kind of walking through tables of brochures where we kind of bring it to them. It takes them a little bit less time than if they were to go to each agency on their own and learn a little bit more about what they might have in store for them in the future. Are there hospice agencies in town if I need to be thinking about this? Who would I contact? Are there free respite services? I can't afford the more formal services. Is there transportation available for my loved one if I can't get them to the doctor? So we try to bring in all kinds of information about this and talk about the resources that are available locally. I wanted to end by telling you a little bit about what we're finding out about the impact of this program after offering it for 4 years. We've offered it now in 16 different venues throughout Virginia. Mostly we are offering it right now in Richmond. That's the furthest west we've gone. We've done some trainings to try to encourage them to offer it in the Reston and Alexandria area in Northern Virginia, but predominantly it's been offered from Williamsburg to Hampton in that area. And I guess we have offered it once before in Yorktown, and that was at the Yorkminster Presbyterian Church. But I did want to let you know, after 4 years, we are keeping tabs on how folks, what they say about the course and their perceptions of it, so that we can continue to fine-tune it and improve it. And we are working very closely with the Rosalynn Carter Institute so that they know what we're doing. And again, it's a close relationship, and we are taking advice and direction from them as well. Again, a lot of information on here, just a few that I want to highlight. Everyone who's taken the course, and this is pretty amazing, 100% have said they would recommend other caregivers take the course after they've completed the 5-week course. Most rate it at excellent or very good. And if you had to ask, out of the 5 weeks you've just spent with us, which one was most helpful to you? Most folks say that last week. All the knowledge I now have about resources in the community that I didn't even know that existed. Now I know they exist and I know how to access them or tap into them. But they appreciated the feeling of community support and being better able to take care of themselves. Then when we looked statistically, just kind of the fancy statistics, we looked to see over the 5 weeks, the participants are telling us they feel more confident in their caregiving ability. They feel better able to take care of themselves. They feel more familiar with the programs and resources that will help them, and they know where to find the help. I think those are the things that we're most proud of that individuals are telling us when they complete the course is a result. Now what we're doing with this funding that I mentioned to you from the Altria Foundation is that we're asking folks if they'd be willing to stay a part of the course after it ends. What that means is that they don't continue to come back each week, but would they be willing to receive a phone call from us 3 months after the course ends, and we're going to ask them these similar questions one more time. Take us about 15 minutes over the phone, and this way we get a sense of whether there's an impact several months after folks have completed the course. And this actually, even though the program's been around for 16, 17 years now, folks are not studying it longer term, and so we're really excited that we can make that contribution that the Rosalynn Carter Institute's very interested in. Few charts just to show you maybe a little easier on the eyes to take a look at. This number is right under 60% in the purple. Do you think that your loved one that you're caring for or the resident you're caring for at the nursing home will have better health because you took this course for yourself? And almost 60% said yes, I think their health will improve because I've been in this course to learn more about my job as a caregiver. Do you think that visits to the urgent care or emergency department will decline because of your role in this course? And this wasn't quite as convincing, but 37% said yes, and another 37% said no, and then another 28% said it depends on the situation. And we don't ever advocate that if you're worried about your loved one's health, certainly call the doctor. But perhaps it could be a doctor's call or visit rather than going to the emergency room, which we know can be very traumatic and disorienting to all of us, let alone somebody who is more frail and perhaps has some memory issues. Do you think you as a caregiver, as a result of this course, know how to better enjoy things in life that you find pleasurable? So we really try to give caregivers permission to take back some of those hobbies, reading, gardening, traveling, at the best ability that they can, depending upon their caregiving situation. And 86% said, I think I'll be able to do a better job of enjoying things I like as a result of this course. So where are we with things? Well, this is an ongoing program of our center in Williamsburg, but we're happy to bring it to whatever communities want to have it and host it. And so, for example, we'll be starting in about a week and a half in New Kent, in Providence Forge at their public library. We have folks in New Kent routinely call us in Williamsburg and say, I either have to go to Richmond for my health services or to Williamsburg. And so while we can't control all of the health services, we can at least bring this program to their public library and offer it there. And so we're starting that the end of this month. We'll be offering this program in Gloucester in January, and then here in Yorktown, hopefully, starting in February. We charge individuals $35. We think that's a pretty good deal for many, many resources and materials and food. We feed you during the 5 weeks. And a safe environment to be in. And we have scholarships available thanks to some funding and these awards and some of these grants that I was telling you about. We have funds that if somebody says, I need to take the course but I can't afford the $35, no more questions asked. We will waive the fee as long as we have these funds, which we have a good supply of right now. We also can even help cover the respite care costs. And so that's what I was mentioning to you earlier. If somebody says, I'm not sure that I can get to the course because I'm worried about my loved one and their care while I'd be gone, then we'll help work with them to get something in place and even perhaps help cover the cost of that while they're in the course. We're always looking for places that want to be host sites or sponsors where they can provide. We'd prefer not to have to pay for the space when we do the room, when we do the course. We understand that agencies may need to recover some of their costs, but we're looking for partnerships. So the library doesn't charge us. We're a nonprofit, and we can reserve the room. And then we may look for a sponsor who would cover the refreshments. And then we can keep the fee down very low for the attendees. We also at our center maintain a master list of caregiver support groups that meet on a monthly basis from Williamsburg to Hampton. And so if you're ever interested in that list, it's on our website, or we can get you a hard copy of it. I can make sure that Minnie has current copies of it here. Yes, looks like this. It's a front and back kind of a table that we've done, just a chart. And this lists all of the monthly groups that meet from Williamsburg to Hampton, and who to call and where do they meet and what time and all those things. And that's something that came as a result of our original research study 4 years ago, is that guess what? When you look in the newspaper, there are caregiver support groups meeting everywhere. Not really when you call them and you ask. There are many, many more that sound like they're meeting than are. So this is an active list. In fact, I just updated it a few days ago. With a group that had changed that meets at the YMCA in Williamsburg. So we keep that updated, and we encourage folks when they finish the 5-week course to then perhaps move on into a monthly group. And in fact, Minnie, I don't know if you remember, but when the York Minster group finished and Holly was leading that group, the end of week 5, we had a little graduation for everybody. You've just committed 10 hours to this course, and nobody wanted to leave. Nobody got up at the end of the course. The facilitators were like, we're done, thank you, way to go, and nobody wanted to leave. So they've now created their own monthly support group that started as a result of that. And we also have a large resource room at our center that folks from the public are welcome to come in and gather resources for. So with that, this is our flyer that promotes the program, and we would very much like to offer it here at the Senior Center starting in February. So I'd be open to your thoughts about your interest in that, day of the week, time of day. We're looking at probably starting late afternoon, so starting at 3:30 or 4 o'clock, and probably having it here in the Senior Center if that were an interest. So any thoughts about that? Thank you for coming. Thank you.